my name is Valley. I'm a student nurse at Rhodes State College. I'm here to change your IV bag and your tubing right now. It shouldn't hurt at all. So I'm going to start off by washing my hands. Okay. And can you please tell me your name and your date of birth? Okay. Gladys Overs, 5/18/51. And I'm going to check her wristband. Okay. Now I'm going to compare it to my physician's orders and my treatment record. And everything matches. Gladys Overs, allergies. Are you allergic to anything? And she said sulfa, so I'm going to check her records, and everything matches. So my physician's order says 500 milliliters of sodium chloride to infuse IV over 5 hours. Okay, so now I'm going to check my 3 rights of Dr. Trimp. My dose is 500 milliliters over 5 hours, route intravenously, time is now, individual Gladys Overs for hydration, medication 0.9% sodium chloride, and my expiration date says 12/22. So for my second check, dose 500 milliliters over 5 hours, route intravenously, time now, individual Gladys Overs, medication 0.9% sodium chloride, expiration date 12/22. And for my third check, dose 500 milliliters or 5 hours, route intravenously, time now, individual Gladys Overs, medication 0.9% sodium chloride for hydration, and expiration date is 12/22. Okay, so now I'm going to show you my calculation. I got 33 to 34 drops per minute. It's a little bit wet. Okay, so 20 drops over 1 milliliter. 100 milliliters over 1 hour, 1 hour over 60 minutes, and I got 2,000 over 60 and 33. So there's my calculation. And I'm going to turn this over here so you can see my setup. First, I'm going to check my bag to see if there's any anything floating or any discoloration, any holes, and there's not, so we're good. So over here, I'm going to compare my bags, and everything on it is the same. 0.9% sodium chloride, 20 milliliters per, 20 drops per minute, sorry. Now I'm going to undo my new tubing, and I'm going to keep all the tape on and everything. I'm just going to start off. Okay. I'm going to unplug it, or I'm going to clamp it first. Make sure that my clamp is on. I don't want it to spill everywhere. Then I'm going to take this and I'm going to plug it into my new bag. I'm going to make sure that the drip chamber is filled to halfway, and I have my bowl right here to catch. Okay, so I'm going to unclamp it a little bit and make sure that it's primed. Okay, if you can see it dripping, it's dripping right now. Okay, so once it's primed, I'm going to clamp it again, and then, I'm going to hang it up. And once it's hung, I'm going to remove my tape. Okay. So much tape. And I'm going to set it down on my table. I am going to put my gloves on. And I'm going to check my site for any redness, swelling, infiltration, heat, cold, anything like that. So my site looks good. And I'm going to, then again, I'm going to look through all my tubing and make sure that all the extra water was out. And everything looks good in here. After I primed. Set this down. I'm going to remove my old tubing. Oh, before I do that, I'm going to clamp my old tubing so that it doesn't go everywhere. Okay. So now that my tubing is clamped, I'm going to remove it. and since I don't have a J-loop, I'm going to act like I plug it in, but if I did, I would be very careful to not like move it around and hurt my patient. Okay, so now I'm going to take my new tubing, and I'm actually, before I do that, I'm going to take my alcohol pad, and I'm going to swab it for 15 seconds. Okay. Now I'm going to take my new one. I'm going to carefully insert it into my J-loop and secure it with my tape. Okay, so once that's secured, I'm going to unclamp my tubing. Okay, and I'm going to come back over here to my new tubing, and I'm going to verbalize that it's going 33 drops per minute. So I'm going to count for 15 seconds to see how many drops come out. It's going a little fast. 1, 2, 3, 4, 5, 6, 7. So it's at my 8 to 9 drops. And I would then check it for a minute to make sure that it lines up with the 33 to the 34 drops per minute. And it does, so I'm good with that. Now I'm going to come back here, and I'm going to make sure that my IV is on correctly and it's comfortable with my person. Let me set this over here. Okay, I'm going to take my gloves off, throw them away, and I will clean up my area. And when I document, I would want to document that the patient reacted good to the medicine, and that there was no infiltration or redness or anything around the site. And also that I gave 500 milliliters over 5 hours, and it was 33 to 34 drops per minute. So I'm going to wash my hands. And I verbalize what I would document. So I'm going to wash my hands, ask my patient if she needs anything, if she's comfortable, make sure her call light's in reach, and make sure that she is